Hi, I'm Dr. Mike Rozboril, a rheumatologist with SIMEDHealth, and my office is in Gainesville, Florida. AS, or ankylosing spondylitis, is a form of inflammatory arthritis. It oftentimes affects the spine and runs with a number of other conditions like psoriatic disease, even eye disease. Inflammatory bowel disease can have very similar characteristics with the ankylosing spondylitis. It's a little unique in that it often starts at a young age. People in their teens and early 20s can develop ankylosing spondylitis, and they can suffer with their arthritis for the rest of their life. Plays a big role in ankylosing spondylitis. There is a gene that's associated with it called the HLA-B27 that has this high association with it. And so if someone in the family has that gene, there's a pretty good chance that either a sibling or a child will develop it as well. The most common sign would be pain in the low back. Women, however, can have neck pain as a presentation, but the back pain is typically what we call inflammatory in nature, and that means that they are very stiff in the morning when they wake up. They will have pain at nighttime. The pain actually improves with exercise and activity, and it feels worse with rest. Ankylosing spondylitis is diagnosed primarily by the history and the physical exam. Exam findings would be tenderness in the sacroiliac area, limitation on motion. Sometimes sedimentation rate or the CRP will be abnormal and high, but other times they can be normal. Typical way to diagnose it is by X-ray, although some patients require an MRI scan to show up the inflammation in the sacroiliac joints. We often start with non-steroidal agents like ibuprofen or naproxen, and for patients who do not respond to that type of medicine, we have more advanced therapies called biologic drugs. Heat is important. Psychosocial counseling sometimes is necessary because people get depressed because they're young and they're hurting all the time. With ankylosing spondylitis, I think that movement is probably the biggest thing. Getting up in the morning, stretching, doing some exercise, taking a hot shower can really help one get moving in the day. Stopping smoking, if you are a smoker, is another important lifestyle change, since ankylosing spondylitis does affect the lungs. If you are a smoker, you're going to aggravate that condition and make life much harder as you get older.